Methylene deoxy and methamphetamine, or MDMA for short, is the main psychoactive component in the party drug, ecstasy. Now this is more like a party setting. So, the pills of MDMA come in all different kinds of shapes, sizes, and colors with a great variety of additives and a widely varying amount of MDMA in each pill, which in the best case will keep you partying all night long, and in the worst case will send you to the emergency room. The effects kicking in after about 20 minutes, your brain will start to make massive amounts of serotonin, noradrenaline, and dopamine, which means that your body will produce pure happiness and bliss, and your blood pressure will go up, and you're awake and more attentive, and you're extremely empathetic. Your feelings are way more intense. You might be wondering to yourself, what are the downsides? This sounds like it's pretty cool. So now that you know your emotions are extremely intense, just imagine if something bad were to happen during your trip, what they so call it. You could easily have a really bad time, and imagine how your emotions will affect that if they're so intense. Imagine also, since all your dopamine and all your happiness levels are just up, rising through the roof, imagine how your brain will feel the next morning. Your brain has used up its entire supply of your happiness hormones in one night. Imagine how you'd feel in the next morning. Now it's time that we have a serious talk after all that. Say you have gone a little bit too far with your drug use. Ecstasy is often abused with other drugs, so treatment plans should be, tailored to each individual person, depending on what kind of stuff you were using with it, or if you were using it by yourself. If it gets out of hand, you definitely need to get some help. So a lot of times with ecstasy, people have some mental health issues after taking it so much, because it obviously boosts your levels so high that you just get a little sad. The come down can be really hard for some people. It's recommended that you search some rehab and get as much help as you need. Unlike other drugs, withdrawing from ecstasy is not usually per se painful, but it is more likely to cause psychological symptoms than physical ones. Some symptoms of withdrawing from ecstasy may include anxiety, confusion, fatigue, insomnia, depression, and even sometimes hallucinations, which is pretty scary. So sometimes a medically monitored detox is necessary, and that's when doctors will keep a close eye on the person who is detoxing from the drug. They need to monitor the people's body temperatures, their hydration levels, because apparently MDMA, it makes you really dehydrated. Sometimes people that take it, their jaws start to clench, and that's sometimes at the point where you need to get sent to the emergency room. They need to look at the increases and decreases in the person's heart rate and their reflexes. So usually no medication is required during the detox, or once you go to rehab, they don't require you to take most medications, but sometimes if you go too hard and you're in too deep, that sadness can just be overwhelming because of how much of your happiness hormones that you've used. So it is sometimes recommended for people to take antidepressants when they're coming down. So if you need some help, get some help. There's always help.
I'm Michael Jordan. Stop it. Get some help.